We must do everything possible every day to protect our communities and protect our loved ones.
BC's top doctor is making it clear everyone needs to do their part to stop the spread of COVID-19 right now.
It is spreading in our communities. We know that. We know it's spreading in communities around the province.
Metro Vancouver care homes are particularly hard hit. Of the 3 new deaths, one was at the Lynn Valley Care Centre in North Vancouver, the other at Harrow Park in Vancouver. There are now confirmed cases at 6 long-term care facilities in the Lower Mainland. Containment measures are in place at many facilities across BC. Vancouver Coastal Health is prohibiting family visits and resident transfers, and staff cannot work at more than one facility.
We know that the significant impact of transmission in long-term care, and those measures are some of the most important that we have taken and will take.
33 people are in hospital, 14 of them in intensive care. 13 people have died so far in BC, and it's not just the elderly who are getting sick.
People in their 20s and 30s can get very sick with this. They can end up in ICU, they can have a severe pneumonia.
The province has tested 18,000 people. Henry says a backlog of testing is almost resolved, but still not everyone is getting tested.
The testing is really focused on the areas of highest risk. So we're focusing on healthcare workers and on long-term care homes, on hospitals, making sure that we're catching those. But there's also quite a lot of effort going into catching clusters that aren't related to travel in our community.
Unless you're an essential worker, Henry says you need to stay home. Ultimately, slowing the spread of COVID-19 comes down to the basics: social distancing, covering your mouth when you cough, and washing your hands.
The more that we do this, the better prepared we will be for the coming days and coming weeks.
On a positive note, 100 people in BC have now recovered, but BC remains under a state of emergency with limits on crowds, travel restrictions, and school closures.
Whether that is enough depends on every single person out there engaging 100% in what they need to do as individuals to stop the transmission of this virus in British Columbia.
Andrea Ross, CBC News, Vancouver.